Okay, ready?
We're ready.
Diabetes. What is the difference between type 1 and type 2 diabetes? Diabetes is the 6th leading cause of death in the United States at this time. So if you yourself do not have diabetes, most likely you know somebody who does have diabetes or a loved one has diabetes. A good friend of mine's daughter has type 1 diabetes. She was recently approached at her daughter's school by another mother of a school-age child, and the mother told my friend, "Your daughter would not have type 1 diabetes if you didn't feed her so much junk." She called me immediately upset. As I was trying to calm her down, I was upset for her, but I was also saddened to think that the public has such a misguided perception of what diabetes really is and what the difference is between type 1 and type 2 diabetes. The credentials I have to speak to you today on diabetes is I'm a registered nurse of 8 years. I work in a critical care unit at the hospital, and I treat patients with diabetes every day. Over half my patients actually have diabetes, and I not only treat them for their diabetes, but also the complications that come from diabetes. I also did research from the American Diabetes Association, MayoClinic.com, the Center of Disease Control, CDC. So I did some research to share with you the difference between type 1 and type 2 diabetes. Diabetes. The prevalence of diabetes in the United States is 7.8% of the population have it. That's 23.6 million people. That's an overwhelming statistic. 1/4 of those people are actually undiagnosed at this time. 90 to 95% of diabetics are actually type 2 diabetics, and that statistic is growing daily due to risk factors associated with type 2. You may ask, what exactly is diabetes? Diabetes is characterized by elevated blood glucose levels in your blood. This is a direct result from your body either producing no insulin or not enough insulin to help take the blood glucose out of your blood and move it into the cell. If you do not move the glucose from the blood into the cell, your body will lack energy and an accumulation will occur, and that's when complications will occur. Type 1 diabetes. Type 1 diabetes was originally known as juvenile diabetes. Usually it's diagnosed before the age of 30, sometimes in childhood, and it is, according to the Mayo Clinic, the cause is unknown, but some researchers and physicians believe that there is a genetic predisposition for type 1 diabetes, and that sometimes it's actually from an unknown virus that you may have or get, and what this does is it triggers an immune response where your body will actually attack the beta cells of your pancreas. In this type of diabetes, there is no insulin being produced, or very, very little. So there's no cure for this disease, and the treatment for type 1 is insulin. Type 2 diabetes is increasing in statistic daily, and that's partly in large because of the risk factors associated with type 2 diabetes. Type 2 diabetes is usually a resistance to insulin over time. You won't get diabetes type 2 when you're 20 years old. It builds over time. The body does not produce enough insulin or the resistance, but it's usually resistance to insulin. There are risk factors associated with type 2 diabetes. Age is the greatest one. The older you are, the higher chances you have because of your body building up a resistance. Being overweight, just being 20 to 25 pounds overweight increases the statistics of you getting diabetes by 50%. Family history of diabetes. Physical inactivity, it's definitely known and proven fact that if you have physical exercise in your life, the chances of you getting diabetes decrease daily. And this type of diabetes doesn't always require the use of insulin. If you go to the doctors and you're a newly diagnosed diabetic type 2, chances are your physician will actually change your diet to begin with and have you put on an exercise regimen. If your glucose levels are still elevated, then usually they'll try oral agents, and if that does not decrease the glucose in your blood, then they will go to insulin injections. There are numerous complications of diabetes. I just listed a few of the ones that we see mostly. Heart disease, stroke, diabetic neuropathy, blindness, decreased circulation. I can't tell you how many times I see somebody come in at 55 years old and we have to amputate their leg due to a non-healing ulcer from diabetes. There are things that we can do as diabetics to prevent complications. This goes for type 1 and type 2 diabetics. All diabetics should monitor their glucose levels at least 4 times a day. You should be checking your sugar before every meal and before you go to bed. You should also regularly exercise and maintain healthy portions with healthy eating. See a nutritionist for portion control and healthy meal plans. Also, you should follow up with a physician regularly to have blood work done. You should be tested for what's called a hemoglobin A1C. This differs from a regular blood glucose level. Some diabetics believe because they're checking their sugar 4 times a day and 2 of the sugars are in the normal range of 80 to 120 and 2 of the sugars are elevated, that they are a controlled diabetic. But really, when your blood glucose is elevated, you're not controlled. And the hemoglobin A1C will show the doctor out of those 3 months how often your blood sugar was elevated. So to conclude about diabetes type 1 and 2, they're totally, completely different diseases. Type 1 is usually diagnosed before the age of 30. It's usually autoimmune in nature with a genetic predisposition. And type 2 is usually from a resistance to your body to insulin. Type 2, although not always able to be prevented, usually can be hopefully prevented by reducing your risk factors. Any questions?
Bravo.
Do you guys have a question?
No.
Do you want us to have a question?
Yes.
Okay, I have one.
Okay, Janine?
Okay, so with diabetes, you know how some people do the insulin injections and some have that bolus feeding?
The pump?
Yes. Is there a certain age you can... Is it just based on whatever the doctor recommends, you know?
Yes. There's actually not a certain age. Actually, my girlfriend's daughter is 10 and she has the bolus pump, or the continuous infusion. What it entails is maturity.
Okay.
Because if you're not around your child, say the child is type 1 diabetic and the cure or the treatment for type 1 is insulin. There's no diet, there's no exercise because the beta cells of your pancreas don't work at all, so you need insulin. So basically you have to make sure that that child is old enough and mature enough to keep an eye on the pump, let the parent know when the pump runs dry, change the site every 3 days because you could get an infection. It could be a very large infection, so you actually have to change the site of your pump every 3 days. So basically, with the pump, it's great because you're getting a continuous small amount of insulin. You're still checking your sugar 4 times a day, so you're not poking yourself any more than you would be. But they're hoping that your blood sugars will be more consistently where they need to be by getting a continuous dose of insulin. So maturity plays a part of that. There's not an exact age.
Right.
Thank you, guys.
Thank you.
Okay, just show us.
Bravo. Very good. See that?
Are y'all done?
Making sure he shows the crowd that we stayed.